Hello and welcome to Integrated Clinical Vignettes with Dr. Carlo. Number 3. Over the course of the last few weeks, a 9-year-old girl experiencing hand clumsiness and difficulty with speaking prompts her mother to bring her daughter to the physician's office. The mother explains that she has also noticed progressive worsening gait over the last 6 months. Further investigation reveals impaired glucose tolerance and hypertrophic cardiomyopathy. Neurologic examination reveals an ataxic gait, sensory deficit to touch, and disorientation of appropriately positioning her neighboring body parts. The patient's extensor plantar reflex is 2+, all others are 1+. What is the most likely inheritance pattern expected to be seen in this patient? As you see here, all of the answer choices are trinucleotide repeat expansions. They have to be in alphabetical order. As we walk through each and every one of these, I'll give you the clinical significance as to what you should be looking for, and much of this comes down to rote memorization with the actual trinucleotide. Let's take a look at CAG. CAG is associated with Huntington's disease. TON, Huntington disease. The autosomal dominant disorder, characterized by choreiform movement, psychiatric problems, and eventually dementia. CAG. You know that much of this is rote memorization, so therefore I will keep bombarding you with the term CAG here. Huntingtin protein is what's being expanded by CAG. Huntingtin, TIN. The disease is TON. The Huntingtin, TIN protein is crucial for early development of human beings. However, at some point when it goes awry and you have extended expansion, then you have what's known as a polyglutamine tract expansion, glutamine expansion. Who is my patient? Has choreiform movement, meaning that it's jerky, it's rapid, it's involuntary, it's non-repetitive, arrhythmic, associating the face, the trunk, and the limbs. There might be eye issues, eye movement disorders, meaning the saccade movement is slowed down. For example, you reading a particular page is rapid eye movement. The volitional initiation of that saccade movement is slowed down with Huntington's disease. The psychiatric problems would be irritability, perhaps depression, awkward social interaction, and this may precede the choreiform movement years prior. None of this is present in this patient. Dementia. That cannot be avoided. The dementia could present as Parkinsonian-like later on in Huntington's disease. CAG. CGG. CGG is encoding for a condition known as Fragile X syndrome. CGG. Most frequent form of inherited intellectual disability in the U.S. with a prevalence of 1 in 4,000. Amazing. Fragile X syndrome, CGG. It is an absence of Fragile X mental retardation protein, FMRP, due to a loss of function mutation in the Fragile X mental retardation 1 gene, CGG. The classic presentation would be more obvious in adolescence, with having phenotypic issues with long and narrow face, with a prominent forehead, and prognathism. The chin is prominent. There is large ears. Pull on your earlobe. Large ears. Large testicles. Use your imagination. However, testicular function is normal. That testicular enlargement is only clinically significant at least 8 years of age. CGG, Fragile X. CTG, myotonic dystrophy. There are two types, abbreviated as DM type 1, DM type 2. Yes, I said DM. Not diabetes mellitus, myotonic dystrophy. DM type 1 is much more dangerous. The name implies myotonia. What does that mean? The grip of the hand perhaps could be sustained for too long. Myotonia. Skeletal muscles will be affected. Cardiac muscle could be affected. And I understand that our patient here does have cardiac issues. But what about the rest? Iridescent cataracts. Take, for example, a bubble. A bubble that's floating around in our environment. And light falls upon that bubble. You have different shades that bubble will take on of that light. That's what's meant by an iridescent cataract. Different angles of the light falling upon increased density of the lens will give you that type of reflection. There are endocrinopathies that will be seen with myotonic dystrophy, such as gynecomastia, perhaps insulin resistance. Our patient has impaired glucose tolerance. Granted, could be part of myotonic dystrophy, but the remaining symptoms are not present in our patient. The gene CTG, myotonic dystrophy, for DM type 1 is DMPK gene on chromosome 19. CTG, myotonic dystrophy. GAA is Friedreich ataxia. GAA is ataxia. A-T-A-G-A-A. It is the most common hereditary ataxia. Most common hereditary ataxia. Inherited issues with intellectual disability. You're thinking Fragile X. Friedreich's ataxia is a loss of function mutation in the frataxin gene, FXN gene. GAA, trinucleotide repeat expansion. The issues that the patient will have. Number 1, neurologic dysfunction. Ataxia. There might be cardiomyopathy. Our patient has hypertrophic cardiomyopathy. Diabetes mellitus. Our patient has impaired glucose tolerance. There is quite a bit of ataxia in our young child. The most likely answer to this question, ICVC number 3, is E as in epsilon, GAA, which encodes for Friedreich's ataxia.